Good evening, everyone. It's 6 o'clock. I would like to begin the Community Mental Health Full Board meeting. And first item before we adopt the agenda is I'm going to read our mission statement. Macomb County Community Mental Health, guided by the values, strengths, and informed choices of the people we serve, provides quality services which promote recovery, community participation, self-sufficiency, and independence. A motion to adopt the agenda is in order, and just to bring to your attention, we have, it was updated today, but some of you may not have seen it. Item 6G, updated budget, is added to the agenda from what had been sent out a few days ago. I have a motion by Birdie. Support by Selena. Any questions or about the agenda? All in favor signify by saying aye. Aye. Opposed? Adoption of the agenda has passed. Next is hearing of the public. Is there anyone from the public that would like to address this board? Anyone from the public? You have 5 minutes. You can step up to the lectern here and identify yourself and your address.
Hi, my name's Kristen Schramm. I am the sister, paid staff, and biggest advocate for my brothers who live in Shelby Township. They are both developmentally disabled and they receive services through the county, or one does, one no longer does, through no fault of his own. I'm here tonight just because there's been a lot of issues with Macomb County Community Mental Health and the way they have gone about cutting services or reducing services for people with disabilities, and it has affected my brothers horribly. 8 years ago, I had this great idea, and I thought I'd put my brothers into a home in Macomb County because the services were notoriously good. Macomb County had a very good reputation for providing quality services to developmentally disabled people. I worked very, very hard. The home they are self-determined, they're under a self-determined contract, and it's a home of their own. I'm here to talk about Matt mostly because Matt is autistic. He has serious behavioral issues, and up until probably about 3 years ago, I worked very hard getting him to Macomb County. He lived in Genesee County. And once we got him into Macomb County, the services were good. But then they started trying to reduce them, saying that the documentation did not support the services requested. When I asked at the local hearings what documentation, and I've asked it several times, I've never been given an answer. Mostly, I want to say that the way this is handled, I don't know what's going on, mostly. I don't know what's going on. I feel horrible for families who aren't able to come advocate for their person. Horrible, because I know it's happened. And my brothers, I know I've been told over and over again how lucky they are to have me. And it hasn't been easy. I went December, I lost 3/4 of my pay because they cut my hours. I was not able to continue services until the appeal process was over. For whatever reasons, it was a change in policy or something. I ended up to keep the staff because my brother, who's autistic, prefers that I'm not there. I'm like a parent person, and my goal is to eventually step back and be a sister, but I can't do that because every time I turn around, they're trying to put them into a group home, which neither one of them wished to do, and I would not be able to really live with myself very well seeing both of them going into group homes. So I have to be there for them. My one brother, Matt, has serious behavior issues, we can't leave him alone. The county keeps saying, well, you can take care of him for 10 hours. That's not true. At Christmas time, they forced me to provide care to him at a rate of 63 hours a week without pay. That's without pay. If I want to pay, I would have had to work an additional 40 hours a week. That's a week, because they cut the services so far. Through December, what I had to do, my husband and I, God bless my husband, who's had prostate cancer, and we can't afford it. I hate to express my debits around you guys, but I had to take a loan, we had to take a loan to pay the staff, because I couldn't afford, I couldn't live, I couldn't stay there. My brother is he picks up on weaknesses, and if I'm tired and exhausted, he knows it. He gets very anxious about those things. So I can't be in there at that rate. I just can't do it physically. So we paid staff out of our pockets. So in the month of December, Merry Christmas, I was given 3 days' notice, by the way, to be told that I was going to have the services cut. In the month of December, we ended up paying out, I lost almost $2,000 in wages, probably, maybe not that many, but we did pay staff out for $2,000. So I don't know what's going on, but I feel, I'm the one, by the way, that had the cops called on him on November. The cops came to Macomb County Community Mental Health. My name's Kristen. I'm the one. Because I said I need help. When they said they're cutting the services, and I said I need help, I don't know what to do, I can't take him home, they called the cops. I had 2 people meet with me. One of them was Lori, who does what she can do. And the other one was Mark Michelle, who's the recipient's rights advisor. And I thought, well, good, he can help me. No. I was threatened also to be arrested, put into jail, have my brother taken by the courts, and I wouldn't be able to see him anymore. So, like I said, I don't know what's going on. I feel that most of you guys are good people, understanding people, so I know it's not really your choices, really, but you feel like you don't have a choice, maybe. I don't know. But this can't continue. You need to sit down with people. If I'm aware that there's financial problems or whatever it is, don't tell me the documentation doesn't support the requested services, because if you can't tell me what the documentation is, how can that be fixed?
Ms. Shreen, thank you for being here.
I can't filibuster this.
There's 15 more seconds, but if you need more, I will give it to you.
I'm fine. I just want to say that I'm willing to help out in whatever ways I can, but you guys need to, whatever it is, you need to find a way to speak to the families and find a way to work on this. It's unacceptable the way it's happening. Thank you.
Thank you for being here, and thank you for advocating on behalf of your family. Is there anyone else from the public? Anyone else? And somebody will be contacting you.
Thank you.
Seeing no one else from the public, we'll move on to item number 4, which is approval of the minutes of our regular meeting of the board that was held on December 19, 2018. Motion by Flynn, supported by Phillips. Any questions on the minutes? All in favor signify by saying aye. Aye. Opposed? Motion carries. Next is approval of the standing committee meeting minutes of program and budget that was held on January 9 of 2019.
So moved.
Motion by Doherty. Support. Supported by Schmidt. Any comments or questions? All in favor signify by saying aye. Aye. Opposed? Motion carries. Next is item number 6, which includes items A through D, residential leases that we had discussed at the prior program and budget meeting.
I make a motion to approve the residential leases.
Motion by Flynn to approve items
A, B, C, D, E, and F and G.
We'll go through F.
Okay.
Okay, motion by Flynn to approve items 6A through F. Supported by Birdie. Or, no, you want to make a comment?
I'll support.
Supported by Kraft. And Lou, you want to have your no votes carried forward?
Separate A through D. C is into E and F. So if
might want to vote no on the other item, but I will vote no on A through D.
Right, so we will carry, unless you want to make additional comments, we'll just carry forward your votes from the committee meeting.
As long as that registers for no on A through D.
I will make sure it does. Nick?
Yeah, on the agenda that got mailed out, which I was working from, I usually go to the electronic one, and I should have, obviously. Mine only goes to E, and so I would like to separate the residential leases and do E, F, and G separately, so we could give a little bit of an explanation.
Sure, that's fine. Let's do this. Let's, just to keep it clean, let's first go with the residential leases, A through D. Motion by Flynn, supported by Kraft. And Lou, we'd have just the leases now, so we'll carry forward your no votes. All in favor signify by saying aye.
Aye.
Opposed? We've got Lou on those 4. All right. Then we have item E, which is request for approval of an electronic prescription client agreement. A motion by Flynn, continued support by Kraft.
Yeah.
Any questions on that? All in favor signify by saying aye.
Aye.
Opposed? All right. Then we have item F, approve the Macosa request to issue additional 30-day contract continuation letters to substance use disorder providers to allow for county processing of fiscal year 2019 contract. Are there questions?
Support.
All right, motion by Doherty, supported by Flynn. Commissioner Doherty?
So do we, why are we asking for this extension? Was there some extenuating circumstance that caused us to not get this?
Well,
Yeah, I mean, I didn't know what was going on with the contract that.
Forget it.
Good evening.
Hello.
Good evening.
Reason that we're asking for a continuation is because we went through the normal process of getting the contracts approved by the corporate counsel office, and we got a sign-off from Aaron Thomas, who is our representative to the corporate office. He said, I have to talk to my boss, which is, which is John Schwab, I think is his name.
Shapka.
I don't know why I can't get that name. And he said, no contracts will be approved by this office until they have been reviewed by IT in the county, finance in the county, and also critical management in the county. So that put a halt on things. I sent him a letter and I asked him, well, why is this the case? This is not how we usually do it. And a few other choice words that were well-written, I'm sure. And then he came back, and we asked him if we could bypass that process this year, because from that time forward, we had like 3 weeks to get the contracts up, ready, and go to the providers. And I said, if you do this, we won't be able to do that. And he sent me a note back that said, basically, based on the fact that this board went to the county with a budget overage, he thinks that the finance committee would be necessary to review that in process. And so that's where it is. I sent it to finance. I also sent, they sent it off to the risk management. We did not send it to IT. I did ask what was the relevance of sending it to IT, particularly when you've got that we don't even use the county's IT system. So the budget came back today, or the contract came back today. We got it about 4 o'clock. So not enough, because we still need to have the extension in order to process it. So I will be bringing to you the contract. There's very little changes in it, not anything of any consequence, but I will wait and bring it to you next month. In the meantime, what we intend to do is compile everything, get them out to the providers, get them ready to sign, and then, assuming it'll pass next month, we'll be ready to go. But the other concern, if we don't do something right now, we wouldn't have a contract
Yeah.
to work on it, it's work stoppage you're going to have. We wouldn't have any service.
Right. So I appreciate the detailed explanation, because that
Okay.
answers what the delay was. I kind of asked for a couple different reasons, because I thought maybe some of the timing around the holidays, and wondered if our process, especially given the time of year, needed to be backed up or started sooner. I was just kind
Okay.
of more thinking process-wise, or wondered if there was some issue with other funding. So I'm satisfied with the answer that you gave with regard to my motion to approve this, and I don't have a problem approving that. But I guess my question then to our director, our executive director, is can we anticipate this type of slowdown from the county for other matters? And how are we planning to address this? Because if we have to wait for the Board of Commissioners Finance Committee to review everything that we do, it's going to be a little bit of a problem.
Yeah,
Right.
definitely, it can slow things down. There were two messages from the county related to the legal review. I did share both of those with Kathy, and with a question whether or not this was a trend. So we will do some planful follow-up and see if we can make sure things get processed timely.
Okay, yeah, I mean, I'm not disputing the board commissioners or the executive office or any of the county needing to see whatever they need to see, but I think there needs to be some reasonableness to it in terms of expected turnaround times, or if we have to give more lead time, and whether or not IT needs to look at it, I think we have to set some reasonable
It
expectations.
was unfair to us to do it the way they did it.
Absolutely.
Because they cut in the middle of the process, and...
Yeah, they changed the rules without telling
Yeah,
you.
but now they claim that they've been doing that with all other contracts for years, but they haven't done that with ours. And I would have had 3 days to be able to pull them, to get them together, and then before I could bring it to the full board for the contract. So
I see.
the timing, was bad. And it wasn't, we were there on time, we got it in, we didn't
Per
get
your
it
normal
back in-
process, right.
Yeah, we were on time to have it done. And it was initially approved by our representative from them, so.
Yeah, so, okay, well, and that's just, and something to keep in mind, I guess, when we talk with the powers that be, that we just ask them, so in the meantime, do we not pay these bills? Do these people go untreated, or what is their proposed action that we should take in that timeframe?
Right. I think a little bit of what you're getting at will be addressed in the next item when we
Okay.
adjust our budget, so.
Thank you.
Oh,
Thank you, Randy.
You're welcome.
any other questions or comments on this motion? Nick?
And just two quick things. I agree with Susan. I mean, we'll deal with whatever process the county puts in place, but we just have to have enough notice to be able to operate timely. My only question to you is 30 days going to be enough to handle all this, considering the...
Yeah, so we're all prepped and ready to go as soon as we get
Okay.
approval here. Again, we'll send everything out to the providers, and we won't sign on our end until after the board approves it for the next meeting.
And the county exec has to sign.
And county exec, yes.
All right, okay, thank you.
Okay, anyone else? All right, we have a motion then. All in favor signify by saying aye. Aye. Opposed? Motion carries.
Thank you.
Thank you. Next is item 6G, which is the updated budget, and that was on your desk there. It's the 2 pages with the spreadsheet with the colored columns. And I think you want to just go over that?
In very brief summary, in speaking with the county executive's office, the budget which we had developed for this current fiscal year was completed in the middle of last year, around May. That again was to be timely and to go through all of the various steps that are required. But when you're completing something that early without having all of the available information, there's a guesstimate involved in that. The guesstimate showed that we were projecting a loss for this fiscal year, which was raising some of the concerns which may or may not have impacted the contract review process that Randy just was describing. In speaking with Al Lorenzo, the request was that we update the budget. I talked him through it, and there were two things. The staff and John, prior to my hiring, had put a lot of activities into place and had a lot of activities planned to address the projected shortfall. Some of those just went into effect on January 1st of this year. When we reviewed all of those, our projected deficit decreased to approximately $3.5 million. At the same time, on the revenue side, there was $3.4 million in additional revenue that had not been included in our budget projections. Because of those two things, we are predicting and we are on track to end this year at break even or better. So we are working the plan, we are putting tracking mechanisms in place to address that. We met with Al and Steve today, earlier today, and reviewed everything, answered all of their questions. Cindy and Jim joined me along with Kathy, and they were comfortable at the end of that meeting and requested that we make these revisions that are in front of you and that this body approve those, the updated budget, which would then go to the Board of Commissioners.
At this time, I would like a motion, and then we'll have discussion.
So moved.
Motion by Doherty, supported by Phillips. Susan?
Thank you, Madam Chair. So, I'm sorry, I just looking at this for the first time, so I haven't had a chance to really digest it. I'm finding myself scrambling a little bit. So, the first page is revenue. And so the first kind of, I guess, will be the set of numbers in that chart, kind of in the middle of the page, is what had been done previously in May. Am I understanding that correctly?
The left hand.
Yeah, kind of the left side, left of the light blue, right? That's everything that had been done in May.
Cindy, would you like to?
I just want to make sure I'm understanding this right.
Right, this is the format that we do once a year when we present the budget to the board here.
It looked a little familiar to me, but-
Right, because what's confusing is the actual way that we give it to county finance. The line items don't align exactly to how we do it.
Okay.
And so we do a crosswalk, basically. So on this, what we did is we just took what we used back in May, and then knowing what the changes were, again, what Dave just referenced, there were 3 items that are showing about a 3.4 million increase for our revenue. So we put those on the light items that we expect those to hit, those being Medicaid and then the special legislative grant.
Okay, so that's 2 changes, right? That's 2 new revenue streams, which are represented on the right hand, kind of right of I'm assuming that blue is kind of like a dividing line, right?
It is.
Okay, so everything to the right of that blue is showing this added revenue that we were not expecting before, but now are putting into the budget,
Well,
correct?
on the right, the very first yellow column on the right of that blue
Yep.
is showing what was actually approved by the county.
Agreed.
Totaling to the 193. And then you see our change, which brings it up to 196. And then the next column just highlights where that 3.4 is going to. And it's not actually, I wouldn't call it a new funding line stream. The one was the modification to hitting our Medicaid. specifically attributed to the new Medicaid rates that came out. And again, I'm keeping in mind that some of our difficulties that we have when we go through that budget is, for example, this was due May, June timeframe. We had a new rate call back in September for what would be in place for October, so you can see our
Right.
struggles.
Right.
At that time, they stressed to us, do not use those for budgeting purposes, that we'd be getting new information in January, which when we did in January, again, that's, how many months into already 18, 19. But to answer that question, going back though, it is for the stream, it's not, it's a change to our Medicaid cap, what we're expecting also with looking at trending eligibilities, and then also the PBIP, which is the performance-based that was brought to, I believe, previous board meetings that was discussed, and what we should be getting about the 1.4. And then the other line item we separated out was that 1 million that we received in the special legislative grant. And that was again brought, I believe, at the December board meeting in detail, or even the earlier, in December, as far as the 3 areas that we're covering with that.
Okay.
And again, we didn't get confirmation on that until after our budget was submitted to the county.
Right, and I know we've always struggled with the timing of the budgeting versus our fiscal year versus when rates come out. I mean, we've always had that
Correct.
ongoing issue of trying to forecast without being overly optimistic.
Right.
I get that. Okay, is there any, well, we can talk about that at another time. Okay, so that helps me understand why these revenue changes are appearing now. So that's good on that page. And then on the expense sheet, we are adjusting expenses. It appears that, they're increases, right? They're increased expenses.
Yes, and actually, even at the meeting today that we had with county finance, and we'll be having continued meetings with them, with the county finance staff, along with the CMH staff, as far as, again, getting our arms around the entire budget process and the expectations, and I think just some changes between both county as well as with us, as far as the expectation that what we need to present to them has always been what's considered to be a balanced budget. So, like in this point, yes, our revenue went up, and then we went for that funding to balance that with our expenses. So that's where you would see, for example, the easiest one probably to point that out would be with that legislative grant. We have to justify using all of those funds, or we don't get that revenue. So obviously, we want to use that accordingly and appropriately and be able to document that. So that's where we built it into the budget on the expense side as well.
So just thinking about that, that money, it appears that, so a lot of it went to miscellaneous and non-provider contracts, right?
Right, a lot of that would be staffing,
Okay.
staffing, the contract services.
Okay, and then like 95,000 went into an advertising campaign?
And that went into the advertising, and again, with the legislative grant, how that grant was written and awarded to us, it was very specific. It was broken down into 3 categories, and one being, I believe it was 100,000 strictly for advertising.
Okay, and that's like more of an outreach and some of the
Correct.
social media stuff and the planning that we've
Correct.
discussed at previous meetings.
Yes.
Okay, I just want to make sure that I understand where the money's coming and going. All right, thank you.
Flynn, and then Sue Material.
Thank you, Madam Chair. I see a lot of zeros on this budget, and I take recipient sitters. Recipients, we don't have any more.
The respite sitters,
Yeah, the
those are
respite.
programmatic changes that occurred.
And we don't have any respite care at all.
No, we do. It's just, again, this is basically a crosswalk. Again, if you would see the budget and the line items and our orgs, and they're called object codes, how it's built into the budget, it is pages and pages long. So this is just a summary and how it's rolled up into the county budget, and they group them into different categories.
And the same with my child.
We no longer have My Child funding, correct?
What's this camper ship? Camper ships?
camperships? I'm going to defer to Jim if you want to speak to that.
Through the chair.
Healthy Michigan.
It's a program that's offered during the summer where we can provide limited day program camperships to consumers. They will typically go for, I think it's a week, and it's kind of a therapeutic campership program that's offered during the summer.
Okay, but we do have respite care.
We do.
Yeah,
Thank
there's
you.
no change.
Thank you, Madam Chair.
Nick?
Yeah, there's no change in respite, that's why that's a zero, right? So
Correct.
just looking at all of this, I guess I have two questions. I mean, I see us getting more Medicaid dollars than we initially thought, and then putting it into Medicaid, which is where you would expend it now, without splitting it all up. And the grant dollars was split according to the grant, I'm assuming. There's one little note here that says $1 million Medicaid cap eligibility increase. Medicaid's not capped, it's an entitlement program. What is that?
Well, it's our capitation rates, and so based
Oh,
on what we receive.
capitation rate.
Yes.
Gotcha. Okay, that makes a lot more sense then. The other question I have is that you put in 3.4 million, you took out 3.4 million. How did that impact our bottom line balance sheet?
Well, again, we actually put it in both. We put it in revenue as well as expense, and that's what I was trying to
No,
explain.
I understand. You got 3.4 million, and then you added it in to increase our expenditures to 3.4 million, right?
Correct.
And so I understand that, but the original budget had a bottom line that was in the red.
Correct.
And I thought I heard David say, now we're not in the red. If I put in if I put in $5 and I take out $5, but I was $10 in the arrears before, I'm still $10 in the red. How did we get to the budget balances no matter what you do? I understand that, but I'm
Right.
trying to figure out what ended up getting us to the point where we were able to say to the county, there's no shortfall.
Well, there's a few things that come into play, and I'm not sure if Jim or Dave want to expand on this as well. But back to when this budget was done, there were, since that point, well, a few different things. The projections that we had, again, knowing where we were coming in, that's where we were looking at the deficit that we're expecting for 17-18, which again, we don't close that out until February. So knowing that, again, we're trying to build a budget off of what we're
Projections.
expecting to
Right.
come in.
Budgets
at.
are projections. I
Correct.
understand that.
Correct.
So I think what you're telling me is that once we got better data and our projections were shorter, that meant the demand was lower?
Well, it was not only did we have better data, meaning there were more actuals each time we completed one of those reports. Also, during that time frame is when the strategic planning was going on. So that matrix, that strategic plan that Jim has presented in the past as far as cost savings areas, those have also come to fruition now. So are also, when we're looking at where we're expecting 18-19 already preliminarily, that's where we're saying we addressed that deficit issue for 17-18. That's where we had those conversations about drawing down from our ISF and why it's expected to be at about 3 million. But that's taking care of that deficit. So now with the programmatic changes, we're looking at, along with the additional funding, to be in that better position. And that's what our projections are showing us right now. And again, closer monitoring, and we're putting in a tracking, on any and every one of those savings areas that we were looking at, from, again, where we're seeing on respite, where we're still monitoring CLS, things like that.
And I guess then my question would be, obviously you build in to the budget any amount you're taking out of the ISF. What will be the bottom line impact between where we're at now, or where our projections are now, as to how much out of the ISF we're going to have to use?
For 18-19, we wouldn't have that yet. We'll have a better idea of that when we first even see where we start. But based on where we're trending, we're not expecting any more of dipping into that ISF. Again, looking for improvements rather than, reductions to it.
Okay, thank you.
So wherever we end, as of October 31, which is still being accounted for. We'll know that next month.
Correct.
Whatever that balance is, we're expecting to have that same balance at the end of the 19 year. Is that?
Hopefully stronger.
I mean, that, right, or even
Correct.
stronger, as was said, yeah,
Correct.
even better, but that's the difference in the 18-19 budget compared to last year's budget, where we knew, and we did in fact, have to use some of the fund balance.
Yes.
Okay. Any other questions? Lou?
I was fine until your final comment there. Now I'm confused, and it's not good to confuse me. We were projecting, or we had been informed of a $10 to $13 million ISF shortfall. Remember that?
Mm-hmm.
Next month, with the addition of some $3 million, and it's been applied, what's your projection for the ISF shortfall at the end of October 31st, 2019?
I won't have that until we compile everything that we're going through right now.
But you will do that in February.
We do that in February. We report this
Correct.
up to the state February 28th, and then for the
So
March.
that's where I was confused, because in February, we need to get that projected anticipated ISF shortfall, because that's the challenge for October 31st, and that's the problem with the county executive, and that's the problem with the State Department, who started this whole thing by cutting us $45 million, which, again, in my opinion, was part of their plan. There are at least 6 PIHPs in the state right now who are in the same boat of being bankrupt, basically because of the ISF situation, October 31st of 2019. And again, in my opinion, that's exactly what the State Department is striving for, because then the State Department can project to the legislature that the PIHP and the public system is not able to be sustained, and it'll get back to their privatization situation with the healthcare organizations. So it's extremely critical that we get our hands on that particular situation come February. And your comments kind of left me in a little bit of a cloud, and as I said, I don't like to be confused about financial situations, because I had projected, if you recall, that the ISF shortfall would be closer to 13 than it would be to 10, and now, subject to additional data, I think we need to revise that situation. If we get it under 10, then we're trending in the right direction appropriately, so that would be critical next month. So that's the comment I wanted to make, and if we're in agreement, I'm unconfused, which is better, trust me.
I think we're talking about two different things. Whatever that number will be in February, the number from October 31 of 2018, which will be confirmed in February, that bottom line, that fund balance I'm talking about, and I'm not talking about shortfall or anything, the fund balance we will not have to dip into that for the 2019 budget.
To cover that, correct.
At the same time, you need to determine the status of your ISF.
Of course we do that.
If you don't do that,
Separate subject.
the rest is impractical and doesn't mean a thing.
Okay.
It's the ISF that will doom us,
Correct.
not the budget balance.
But
It's
what we're
the
talking,
status of the ISF that will throw us into the wrong column. That's the challenge.
I don't disagree with you on that, but tonight we're talking about the budget, and this is a budget adjustment, so that's what we're looking at for tonight.
I understood that.
Okay.
But the challenge is the ISF, and I wanted to clarify the fact that come February, we would get a handle on that situation, because if we don't do that in February, we're dead against October 31st.
Thank you. Is there anyone else? All right, seeing none, we have a motion to approve the budget changes. All in favor signify by saying aye.
Aye.
Opposed? Motion carries. And this is the sort of thing I'm happy that we've done tonight, because there have always been the working adjustments, and we never changed our budget. And I used to ask about that. Shouldn't we be changing our budget to reflect this? It didn't happen, so I'm glad we're on that track now. I really am. All right, next is item 7, receive and file. I don't think we have any documents for that. And next is 2 resolutions, one for Connie Lasher and another for Donna Onifer for retirement.
So moved.
Motion by Doherty, support by Phillips. All in favor signify by saying aye.
Aye.
Opposed? Motion carries. We will let them retire. And next is item number 9, the voucher listing, payment of the bills.
I say pay the bill.
All right, motion by Birdie, support by Flynn. All in favor, I'm sorry, any questions, first of all, or comments? All in favor signify by saying aye.
Aye.
Opposed? Motion carries. Next is the management report.
Good evening, everybody. On January 17th, I celebrated 30 days. And this is my first full solo board meeting, I guess. The report that I'm used to presenting, I start at the federal level, bring it down to the local level. I'm wide open for feedback. But to begin at the federal level, there's an article in your packet about the current administration activities related to possibly moving the Medicaid funds to block grants at the state level. The concerns are that that would result in funding reductions and a lack of growth at our level at the every state. The supporters believe it would give the states more flexibility in how to use those funds. So that's the argument on both sides. This has been talked about for quite some time, but it appears to have reared its head again. And President Trump was working with the director of CMS specific to those block grants. At the state level, we have a new governor, and she appointed Bob Gordon as the new director of the Michigan Department of Health and Human Services. There's a video, an introductory video for him that's available on YouTube. I can share that link. He was quoted as talking about his 5 principles, acting on scientific data, putting the interest of the public ahead of his personal interest, treating residents of all racial and economic backgrounds with dignity, honesty, and respect, spending taxpayer dollars like they were his own, and creating opportunities for all to do their best work. So we will attempt to reach out to him and his new staff in the very near future. At the state level, I did attend a meeting at the Department of the Office of Inspector General, along with Kimberly Cope. I was invited by her. It was very interesting. The reporting to the OIG office has really increased. I was well aware of what they were doing earlier last year. They've really ramped up the reporting, and it's very detailed, and they're expecting everything to be reported to their office. The PIHP directors, we went on record with the department asking for access to the detailed data about their funding model. So they're using Milliman to crunch their data, but we don't know what data from our PIHP they're actually sending over to Milliman and how it looks. So we've asked for some transparency and that information be shared. At the regional level, I wanted to thank those of you who attended the Metro Region Dinner on January 17th. We did commit to a resolution amongst the 3 counties finally addressing the COFR, or County of Financial Liability issues, sometime in the next 90 days. Yeah, I hear sighs up here. If you're at all familiar with COFR, you usually will sigh heavily and roll your eyes. We are hopeful that we can resolve those problems. The legislative breakfast I mentioned last month is being held on February 6th. The focus really is on stakeholders. They're asking each of our 3 counties to arrange for about 30 primary stakeholders to attend that breakfast and meet with the legislators. So it's not so much our opportunity to share information specific to our concerns. I will be in attendance, and I might have some of those opportunities, but right now that's the way it shook out. And I do want to thank Amy and Kevin from my office for taking point in that area. At the local level, I submitted a work plan, a proposed work plan, with during my contract negotiation meetings, and that will be reviewed at a future meeting, I guess. But in quick summary, I have and continue to attend meetings with the Community Mental Health Association of Michigan, the Michigan Consortium for Healthcare Excellence, and meetings with the Department of Health and Human Services. There's a lot of those. So meeting that goal will not be any problem at all. Interesting, the updated budget was just presented for action today, and I gave myself until April 1st to accomplish that. So we're ahead of schedule.
All right.
And I have met with the Provider Alliance of Macomb County and with the ARC Macomb, and continuing outreach meetings. For the staff, I'm planning early morning meetings that will be scheduled at the various sites. I've been to almost a handful, and there's probably another handful to go. Those will be early morning meetings so that it's not disruptive. They'll be completely optional for staff. It's intended to be very casual, comfortable, and give them the opportunity to meet with me and ask questions. Again, thanks to the $100,000 grant and Kevin's coordination, I recorded a mental health minute for WOMC radio on January the 14th. That was a first for me too. And I'm working with finance to schedule a meeting with Molina to resolve the outstanding claims issue. I reached out to them. I was copied back on an email that went to finance where they were asking for a meeting, and then finance reached back out to them and they're not responding. So we'll continue to push that area. And we've added 5 new autism providers recently, and we've expanded those services on 2 of our current providers. So there's a total of 7 for the autism services. At the last board meeting, we reviewed the leases at the committee meeting, and there was the issue with the insurance on the 5th one. So TJ and Tracy and I met with an insurance company just the other day. They're very familiar with community mental health, staffing providers, home providers. Didn't work out to be much, but it raised a lot of interesting questions to see if we could get any bang for our buck, since we signed 102 of those leases. So we're going to continue to check around, maybe talk to risk management at the county level and see if there's any benefit. Also, follow up from last board meeting, you had a question about actions we take when we terminate a contract. We do work with those providers. There is language in their contracts that they have to continue to support the people that are with them until such time as there's a transition. And I wasn't sure if there was any more questions.
Yeah, I mean, I appreciate all the work that you've already put forward, especially about the insurance, and that you're continuing to seek maybe to see if there is any alternatives there for that. May not be, but I'm glad that you're taking those steps. With regard to the new contracts, you know, when a provider wants to leave the contract and can't, right? I know that they have to stay and provide the services, but it get kind of, and I don't know what's industry standard for reasonableness, and I don't know what additional steps we need to take as a agency to try and figure out what's wrong with the financial model for that home, or if there's other issues, I guess.
I agree. We do, we keep the responsibility for all of those services to all of those people. So we do, and we are planning follow-up actions. But,
Okay, so just more to come, you'll have more to come on that issue? It just-
Yeah.
Yeah, okay. And that's fine as long as it's
And this was,
there's more work to do.
you know, unique to me, but going forward, I think we'll have a clearer roadmap to how we're going to handle these.
Okay, that's kind of what I'm looking for, is some process or analysis and some ballpark of timeline, you know, what Plan Bs do we have? Do we have other providers? Do we have other, you know, I mean, what is
Yeah.
our process for handling them, and what is our
We will.
timeline for it? That's kind of what I'm looking for. I think we may, you know, I'm worried that there could be a trend, and that we need to be prepared for that.
I agree.
Thank you.
Thank you. Also, I just wanted to get some meeting reminders on your calendar. The Program and Budget Committee is Wednesday, the February 13th in this room, and the February board meeting is the 27th at 6 o'clock in this room. And there's a recipient rights appeal hearing on Monday, the 28th at 7:30 at the administrative offices. Thank you.
Thank you very much for that report. And just to follow up, the work plan, I think the work plan had been distributed to we had seen it and made comments on it. And I thought it only fair to give Dave a couple months to just get used to it. And he's even suggested some changes to it. So we will work on that in the month of February and get that all squared away so that still has 10 more months to finish it out, so. He has, very good. All right, next is item number 11, other agenda items. Nick?
Thank you, Madam Chair. As many of you will remember, ever since, well, it's been about 2 years now, I believe, there was a proposal at the state level, affectionately referred to as Section 298, because that's where it was at that time in the boilerplate, to shift Medicaid funding administration from PIHPS, CMHs in the public sector to HMOs in the private sector. This board and our administration has been very vigilant at battling that. We were able to make 2 changes in the subsequent budgets. One was to limit it to pilot programs, and then to limit it even further to how and when those pilot programs would come about. The reality is you have to amend the mental health code, you'd have to amend our federal waiver, which you can't even amend right now. So all of those are not yet happening, and we were able to delay what was a very bad proposal, in at least my judgment, that was moving very quickly through the legislature. During the course of that battle, a lot of organizations were involved, and we became involved in a coalition of mental health advocacy groups, health advocacy groups, labor unions, disability rights groups, et cetera, very a large group that I've generally referred to at these meetings as the town hall groups, because they and we organized a series of town halls in several counties in the metropolitan Detroit area, 2 in Macomb, 2 in Oakland, 2 in Detroit Wayne, 1 out in Monroe. I don't remember where the other ones were, and gathered a lot of public testimony on that, and have been feeding that to legislators for some time, which is part of what got to our success. The planning group that I'm a part of that helped set those up is now looking at sort of a phase 2 of this, and that is in recognition of the fact that there's a new administration and a new legislature, and about half of the legislators in the House, half of the House members are actually new people, and in the Senate, there's more than half that are new to the Senate, although a significant number of those were House members who moved over to the Senate in the last election. But nonetheless, a lot of new people here that haven't heard these arguments and cases. So we're in the process of planning 2 things. David has signed on behalf of our agency, and appreciate that. One will be a meeting, we'll be requesting a meeting with the governor and with the new department director, and I don't know if they'll be able to make it or they'll send representatives. And we'll put a coalition of people to present information to them as well. And the other will be a box lunch type function. The box lunch type function, which will be held in somewhere in the Capitol complex, either the Capitol itself, the House office building across the street, or the Binsfield office building across the other street. We hope to have in late February or early March. The meeting with the administration we hope to have as soon as the administration is able to. We have been in the process over the last couple of weeks of gathering and getting the consent of all of the organizations that were co-sponsors of the town halls to be co-sponsors of these events. And there's 1 or 2 I think we yet have to get a hold of, but nobody said no yet, so that's good. And as I said, this is just a follow-up to make sure the new legislators and the new administration know what we did over the last couple of years. That is in the process of being formulated. As soon as we can find a room, we've got people working on finding a room and a date, and then of course we'll finalize that list of sponsors that will go out to the governor and the new department director with a request for a meeting, and I'll keep the board fully informed as those things go on. You'll get a copy of what gets sent out as well. I just wanted to make sure everybody knew that we haven't forgotten about that issue. I don't think anybody around this table, Lou certainly hasn't forgotten about it, because he basically hinted at that as one of the departmental objections, which was to shut us down and privatize basically mental health services. And we're hopeful that the information we've gathered will hold sway with the new legislature and the new administration.
Thank you. Anyone else? Seeing none, we'll move on to item number 12, hearing of the public. Is there anyone from the public that would like to address this board?
Good evening. I'm Sean McGregor. I live in Macomb County. I'm here for the CEO report. For our individual served update, CEO hosted a holiday celebration to the community centers. All individuals served received backpacks and gifts to celebrate the holidays. The individual served monthly educational seminar was on work rules and conduct, which I have a handout. For our community center update, Our Clinton Township location received a new refrigerator donated from the Alhambra organization in December. In the month of January, the program received 14 tickets for the Detroit Auto Show. The program received 2 new vehicles to increase opportunities for greater community integration. The program has also received 4 newer computers to help with online applications for employment. At our Anchorville location, they've received a new van for transportation. The program will be receiving a donation for a pizza party from St. John Lutheran Church in New Baltimore. They also did a homemade cookie baking day. At our Mount Clemens location, they have expanded their community and experience group. Meals on Wheels donated money for an ice cream trip. The Greater Morning Star Church donated a pizza lunch. A donation of books has been received for the free library. The program will be getting new windows to reduce fixed costs. And finally, at our Washington location, they delivered over 200 Meals on Wheels. Friendship Church is employing 8 people currently to clean. For our stakeholder update, CEO has hosted the General Teaching Practicum November 21st through the 23rd at our Clinton Township location. There were 20 people in attendance with 10 organizations. The next practicum will be in May. This training is done in 3 days, and the board is welcome to attend. CEO Guardian Angels Parent Group will have a quarterly newsletter in months March, June, September, and December. CEO has raised our attendance policy to increase employee retention. Employees will be given $25 a month for perfect attendance and $50 a gift, $50 for a year with perfect attendance. Creative Empowerment Opportunities employee retention rate for January of 19 was 95%. CEO would like to wish the board of directors a happy new year as well. And CEO would like to welcome David Pankatai, saying that right, as the new executive director of CMH. Thank you.
Great, thank you very much. You've been very busy, and it'll be interesting to see if the initiatives for employee attendance, how that works out, because that's very sorely needed, as we all know. Anyone else from the public? Would anyone else like to address this board? Seeing none, we will move on to item number 13, which is adjournment, and this meeting is adjourned. Thank you, everyone, for being here.